How it is characterized? It is characterized by high levels of proteins in the urine. High levels of protein in the urine. Next, low levels of protein in blood. Low levels of protein in the blood. Next, increased levels of lipids. Increased levels of lipids because of the reduced metabolic rate. Swelling of body parts. As we have seen, there is reduction in protein and leads to the reduction of oncotic pressure that will lead to edema, sometimes called nephrotic syndrome or nephropathy, or nephrosis has numerous possible causes. It is defined as non-neoplastic disease of kidney. It is non-neoplastic disease of kidney. It can affect all age groups, especially this is affected in children than the adult. So mainly this nephrotic syndrome is seen in within the age groups of 2 to 6 years than the adults. Male slightly more likely to be affected than female. Male affected more than females. Nephrotic syndrome is not a disease. So it is a group of symptoms we can see. Proteinuria is seen more than 3.5 grams per day is going out through urine, and hyperlipidemia we are seeing because proteins increased in the blood, and hypoalbuminemia we can see because of loss of protein in the blood, and edema we are seeing. So all together known as nephrotic syndrome. Classification. So primarily they are divided into primary and secondary. So primary is being a disease specific to kidney. So if there is condition which is disorder of kidney, then it is under primary classification. If it is secondary, so renal manifestation of a systemic general illness. अगर पूरा बॉडी का जो जनरल इलनेस का मैनिफेस्टेशन हो या रीनल मैनिफेस्टेशन हो, देन इट कम्स अंडर सेकेंडरी. सो कभी कभी ऐसे होता है सिर्फ किडनी का ही कुछ प्रॉब्लम होता है, पर बॉडी का पूरा नॉर्मल चलता है. वी डोंट अंडरस्टैंड, वी कांट डिफरेंशिएट मच that we have some problem. That comes under primary, and secondary will be the general illness also will be included in it. Okay, primary and secondary. Causes and risk factors. So nephrotic syndrome is usually caused by damage to the cluster of tiny blood vessels called glomeruli. Already we have seen in nephritis also that glomeruli is the small capillaries which are together called glomeruli, and it is in the Bowen's capsule, okay, of the kidney. The glomeruli filter blood as it passes through the kidneys, separating things body needs from those it doesn't require. So ये ग्लोमेरुलाई का फंक्शन क्या है? वो प्रोटीन्स और ब्लड को फिल्टर करता है, ब्लड कंपोनेंट्स को फिल्टर करता है, isn't it? So प्रोटीन्स बॉडी के लिए जितना यूज़ है वो reuptake करता है. It will catch the proteins and the blood components in the glomeruli. Healthy glomeruli keeps blood proteins, mainly albumin, which is needed to maintain the right amount of fluid in our body for seeping into urine. When damaged, Glomeruli allow too much blood proteins to leave your body, leading to nephrotic syndrome. अगर healthy glomerular